Today I'll be talking about the rehabilitation and recovery mechanisms for spinal cord injuries. Spinal cord injuries provide a variety of issues including functional loss and life-threatening implications for afflicted persons. These injuries are complicated and catastrophic, hindering the overall quality of life. In recent years, academic and healthcare professionals have made considerable breakthroughs in understanding the pathophysiology of spinal cord injuries and establishing new rehabilitation procedures to enhance patient outcomes. The global prevalence of spinal cord injuries. Healthcare experts are leading the way by introducing randomized controlled trials and various sorts of healing treatments into the rehabilitation process of spinal cord injuries. For the past 30 years, it has been established that the global prevalence of spinal cord injuries has grown from 236 to 1,298 instances per million persons. Another strategy is motor training, which helps to improve and restore strength following a spinal cord injury, which is a part of a randomized control study as well, to maintain the early and intense motor training intervention for patients with spinal cord injuries. The research attempts to give insight into creative ways and prospective cures that bring hope and progress for those suffering from spinal cord injuries by examining the collective efforts of many individuals. There are numerous rehabilitation strategies for individuals with spinal cord injuries, and some strategies may include motor training, yoga programs, and balance training. In a study conducted by Rahimi and colleagues, spinal cord injury patients can significantly improve their neurological recovery and functional results by initiating intensive motor training as soon as they can perform such action after injury. Another rehabilitation strategy indicated in another study was that yoga programs might help spinal cord injury patients achieve pleasure in a healthier mental state. This is consistent with earlier research demonstrating the advantages of yoga for health and mental well-being in a range of populations, including individuals with impairments. Another study by Unger and his colleagues organized intensive balance training for persons who have suffered partial spinal cord injuries. In this study, findings demonstrated an improvement in balance, showing the potential to enhance functional outcomes for people with spinal cord injuries. Intensive balance exercise improves both balance and mobility. Some advanced therapies included advanced weight-bearing mat exercises combined with and without the use of functional electrical stimulation to indicate the transferability and independence in the activities of daily living with those who have spinal cord injuries. This study showed that spinal cord injury patients can significantly improve their neurological recovery and function results by initiating intensive motor training as soon as they can perform such action after injury. Another type of advanced therapy that I found was stimulation with transcutaneous spinal cords and pulmonary muscle strength and function in people with cervical-specific congenital immunodeficiency. This has led to a significant increase in respiratory muscle strength and function. This study demonstrated the importance of respiratory rehabilitation in spinal cord injury care and the potential neuromodulator therapy to improve respiratory function. Each study correlates with one another as they all express and indicate how therapeutic exercise such as yoga or the comprehensive understanding of emotional well-being needs to be elevated towards the well-being of spinal cord injury patients. These health professionals can shine a light on the findings of spinal cord injury recovery mechanisms. By learning more about the processes of spinal cord injury healing, healthcare providers may better customize therapy techniques to promote the overall well-being of people with spinal cord injuries. These studies have produced a consensus underlining the importance of exercise treatment in promoting recovery and improving outcomes for people with SI.